So here we are today, we're actually in the beautiful town of Old Bonalbo, and we're here to do an event with the Country Women's Association Old Bonalbo branch. We bring a range of allied health professional students out where they connect with the members, provide lots of really useful information that can help them just within their daily lives and with their families and community members. And they also get to do some really fun activities throughout the day, which have a focus on not only their physical health, but their mental health and well-being. Our students get to come out to an area that they wouldn't normally come to. So it's a very rural community. It's about an hour and 40 minutes out of Lismore, which is where UCRH is based. And they get to experience firsthand a little bit of that rural life and I suppose some of the challenges for the community members that are living here. So they hear about access to health service or poorer access to health services, and they can start to see why there's such a need for innovative programs where these community members actually can get the healthcare that they require.
The ladies actually enjoy the younger connection. So it's getting them having an awareness that, hey, these kids, well, I shouldn't call them kids, but these students are actually listening. And they're happy. They're happy to be here. They're happy to be involved. They're projecting enjoyment around what's going on, and they're learning things, and they ask relevant questions, and people then are able to communicate back. And so it just overall just promotes a really good sense of well-being and connection, and I think that's what the day is, well-being, Rural Women's Wellbeing Day.
I don't know, it's so inspiring, to see a community all come together on a random Friday just for the sake of Women's Health Day. There's only so much insight that we can get into what a community needs through academic journals and newspapers and think pieces, unless you come talk to people, especially women who have raised families here, who have lived lives and lived their entire lives within this town, and see people come and go, and for them to tell us their experiences of health and caring for kids and husbands and themselves on top of keeping a house and living in this rural town and dealing with everything else that comes within that. It was really important to hear.